Since September, Dr Henry Bukenya's workstation has been in the Mubende isolation unit. When the number of infections of the Sudan Ebola virus peaked in October, the fear also rose. Dr Bukenya says he was constantly in contact with Ebola patients.
So you may find one patient in a pool of blood, pool of vomiters, pool of loose stool. So to my experience, it scares. So at first it was very hard to adapt and even to go on with that, with management. But however, you sit down and you say, what can I do?
In these difficult circumstances, the doctor says he did not forget his oath of ethics, but there are instances when he was unable to save his patients, especially those who presented at late stages.
When you see you cannot do much for patient, the patient has come in what we call a wait stage, so what we call remission. You really look, you would have helped, but you cannot do anything much. You try to do as much as you can, but the patient, all the organs, the patient are really damaged. They have failed to help.
Medical workers have attended to patients who are vomiting, bleeding from body openings, and have bloody diarrhea or urine. This experience comes at a cost of the health workers' psychosocial well-being. Dr Bukenya has sometimes failed to sleep and hallucinated about the events that happened in the wards.
There are many types of foods that are now becoming my taboo because of what I've gone through. For example, eating meat, red of liver, things related to that color, pumpkin, I really can't take them anymore. So because you really feel like you are in Ebola room.
His decision to treat Ebola patients was arrived at without the knowledge of his family, who he says would have disapproved.
None of our families are feeling good. They were all scared. The moment I told my mom that I'm in Mubende, she cried.
Dr Bukenya does not regret his decision as he has gained more experience, and the joy of seeing his patients recover is unexplainable.
Most of the stuff we get to across, we'll read about them in books. So you come to boost your medical experience and then to become a specialist or skilled person under that field.
But even as they invest their energies into treating Ebola patients, Dr Bukenya says the health workers have not been paid for nearly 3 months.
So last week we almost were leaving to go. We've been here for almost 3 months without anything like allowances or salary. So we have families, we have people, we have rent and a lot of pending issues. One of the nuns we work with almost collapsed in ETU unit. You don't know what I'm talking about. You are inside and then she came out, she found that her daughter was admitted and they wanted 70,000 shillings for the bill from a private hospital. But the nurse could not fit the bills.
Uganda has registered a cumulative total of 142 Ebola cases with 56 deaths, 86 recoveries. No case has been reported in the last 9 days.